Rodriguez and Lori Vavrinick from Fidelis Care. What we'd like to do is invite you to join the conversation by submitting your questions to abc7ny.com, and George and Lori will do their best to answer your questions in the time that we have together. Thanks so much for joining us, guys.
Thank you for your time.
So let's get started. We'd like to begin by knowing just a little bit about Fidelis Care. What does Fidelis Care offer?
Well, Fidelis Care is a New York State-sponsored health plan, so we operate throughout the 62 counties of New York State. And what Fidelis Care specializes is in plans for individuals. So if you were a person and you didn't get coverage through your job, or you lost your coverage and now you were unemployed, or you were over the age of 65 and needed coverage, Fidelis would have a health plan for you. We really focus on ensuring people one by one in all ages and all stages of life.
Good, Lori. We're going to dive in, go deep,
Yes.
Go into the questions, but thank you for setting us up to get us started today. We have our first question in. When does open enrollment end for New York State qualified health plans?
Well, that's a very good question. I think it's a timely question, as open enrollment actually ends, Danielle, on January 31st, which is next Wednesday. So it's extremely important that individuals participate in this chat today, but they also go out there and seek information by reaching out to Fidelis Care, by going into our website, fideliscare.org. That's a good starting point.
Mm-hmm. So you have a bit of time, just a little bit, so
Yes.
it'll be important to pay attention today and
That's
then
right.
do your homework and get yourself enrolled.
Yeah, and it's important because a lot of people don't realize that once the window closes and open enrollment ends, unless you have a special situation, and we'll go into that in just a second.
Yeah.
You don't have an opportunity in the middle of the year, once you find out that you have a condition, to come onto the plan. So it's an important date for everybody to pay attention to.
I think a lot of people too, they think, oh, there's got to be a grace period. Oh, the 31st or maybe the first. No, right?
Yeah, well,
it's hard to
that's
deadline.
one thing. And I think when it comes to health, we shouldn't ask for a grace period.
Yeah.
We should be focusing on health, making sure that, one, we are seeking preventive care, and by making sure that you have a proper insurance company such as Fidelis taking care of that, I think that's a good start.
And I like what you said, Lori. You just don't know. You think, okay, I'm here today, I'm good, I'm healthy, and then over the time, things change.
Things can change. I mean, I've seen it, in my own family where, you can have a simple fender bender. You go to the emergency room to get checked out, and they take x-rays or a CAT scan, and what you think is going to start out as a $250 emergency room comes out being to more like a $2,500 emergency room bill. And you need follow-up care from that. So, we all think we're invincible, but you really just never know when something can happen, and you really don't want to put yourself in that position.
Well said, well said. Let's see what else we've got. Questions are coming in for us, but we're in a little bit of a holding pattern. So I have some questions. Let's get started just with how to enroll, how to go about enrolling. Do you call? Do you go on the website? Just what's the best way to enroll?
I think it's a good question. I think the beauty of all of this is that here at Fidelis Care, we have a diverse group of individuals within our team, specifically within the downstate area of the state, which is the 5 boroughs, along with Rockland, Westchester, and Long Island. We have 225 individuals who are ready and willing to assist you through this process. This is a very complicated process. I think you and I briefly discussed in regards to going into the New York State of Health. As individuals, obviously, we all have the option of going in there and seeking information, but I think as facilitating enrollers on the Fidelis side, we're able to assist you through the process and assist you making sure that you pick the right program that best fits your need.
Yeah. Do you want to say something like that?
Yeah, I mean, some people are really great on the internet, and if you feel that you want to do a little research yourself, you can go to NewYorkStateOfHealth.gov. That is our marketplace, and we call it the sort of Amazon.com way to buy health care. You'll see the options. You can research the plans and prices. You can see if you qualify for any help with the premium. Look for doctors, hospitals, providers that you may be interested in. So many people enroll online themselves, but for a lot of people, they have questions really specific to their own needs, and that's where representatives come in. I mean, our reps speak 36 different languages in George and my area, and all of them are really committed to taking the time to answer the questions completely and find the best plan for you.
What information should you have going in? Like, should you be thinking about your prescription drug costs? Should you be thinking about your deductible? Like, once you start the process, what information should you bring to the table?
I think on top of those two items that you mentioned, also is making sure that
homework, right?
you did your homework very good.
I did.
It's also make sure that we have your provider in our network, and I think that's one of our strongholds is that we make sure that we contract with quality providers throughout the state of New York. We actually are contracted with over almost 80,000 providers in the state. We have a diverse network, so making sure that we have your provider in our network, and we go through that process. At fideliscare.org, you're able to go and find a doctor. Is an option there where you could go and seek information to make sure that we have the doctor that you currently are seeing right now.
Yeah.
You know, when you want to enroll, you also need to bring just some basic information. So you should know what your salary was last year. You do need to pay taxes in order to qualify for New York State health plan. You should be, know the dependent size of your family. Just some simple questions that you'll need to bring, and paperwork that you'll need to bring along with you just for verification. People that come from other countries would need to bring their proof of immigration. So though it's not a long process, but these are things that you should prepare before you come in. For many people, they have a specific doctor, a specific drug that's really important to them. They should make sure that they're researching that on every plan.
Yeah, that makes absolute sense. And when you go through it, the website, it actually is very user-friendly, and it is easy to get through it with that basic information. If you have that at your fingertips, you can get by.
Yeah, definitely. The New York State of Health website is user-friendly. The fideliscare.org website is user-friendly for consumers who are just seeking information. But I think it's extremely important that we also identify what are the needs individuals have as a Fidelis representative. And what we do, and we pride ourselves in making sure that we provide optimal customer service. So we'll go through the benefits associated to prescription drugs, the provider, and really explaining how everything works. Making sure that if you have any questions, what numbers to call. And the beauty of it is that our individuals, we pride ourselves with our staff. You're going to see me mention that multiple times. But our individuals are very good in the sense that they know everything about the community we serve. So if you are out in Suffolk County, we have individuals within Suffolk County who live and know the community. So when they're assisting you knowing specific challenges or opportunities they have faced and could relate to what you're dealing with at that point.
Oh, that's so
Yes.
interesting. So they're really close to home.
Yes.
They can help you with your own situation
Exactly.
in some ways.
So, it's we have insurance agents, but they go beyond that. We kind of are community leaders. That's what we pride ourselves with.
That sounds good. And I also like that you were saying just that you have the whole state, 62 counties, all of New York, so you can really get that specialized help and
Sure.
all the people.
And we're a New York-based plan. I think that's important because, the people that pay the claims, the people that answer your call when you call into member services live in New York, so they're familiar with the needs in the provider network and the needs of specific areas of New York. So, all of our services are completely based out of New York State.
Yeah, let's reiterate this. So this is for New York State, upstate, downstate,
Right.
but
The
New York
62
State, right?
counties in the state of New
62
York.
counties,
Yes.
state of New York. Okay, let's get to some more questions coming in. Here's one. If I already had Fidelis Care in 2017, will I still have it in 2018? That is a great question.
Well, and that's a very good question. Depending on what product you have, obviously open enrollment period is key to that. There's a renewal period, and
Yeah.
For individuals who are part of the qualified health plan and have one of our metal level plans, they will have to make that decision now. And that's where the 31st is extremely important to make sure that they have continuation of coverage for 2018. They might have a change in income, a change within their demographics. It's important that you go out there, educate yourself, and speak to a Fidelis representative immediately prior to the 31st, which is Wednesday, to making sure that you continue that coverage through the remainder of the year.
So, yeah, go ahead, Lori.
I just wanted to say for certain products, products like, for folks on Medicaid or people that have our Child Health Plus plan for their children, there's a renewal process that takes place annually. It may not be for this time of year, so maybe they get paperwork to renew and requalify from the state later in the year. So, there is a renewal process, but for the New York State Health plans, you need to reselect every year to continue the plan that you want.
Okay, that was my question. You're not just auto-renewed?
No.
No. Okay, so you readjust, you look at the plans, you shop again?
Right. So the process
right?
called recertification, just like any other type of insurance, in car insurance,
Yeah.
you have that period of time where you have to select and adjust if there's any changes. The same thing with healthcare, primarily for the lines of business that have to make a decision by the 31st, which is all the qualified health plans, the metal level plans, what we call the bronze, the silver, the gold, and the platinum,
Yeah.
along with the catastrophic. We could get more specific to that later. But those plans that I just mentioned have to make a decision now. So if you had it in 2017 with Fidelis Care, you have to seek assistance and guidance to make sure that you continue that through 2018. And if there have been any changes that have impacted you, you might fall into a more affordable plan, one of which is the Essential Plan, as an example, which is a very common plan that we are offering now since 2 years ago.
With renewal, why do you think it's important to kind of reassess and not just say, oh, I'm just going to pick the same plan? Why do you encourage those to get educated and to do the homework and do the research?
I think there's a million reasons to that, but one is we will make sure that we continue having the provider in the network. There might be, changes within the formulary in regards to the prescriptions.
Right.
Those are ones that come up to mind, but there might be changes within your own personal situation that might, you might be overpaying.
Right, that's
and
what I was
you might
gonna
be
say.
eligible
Yeah.
for a more affordable coverage.
Right. I mean, from year to year, income changes, and a lot of selection is based on income. Right now, people get a subsidy if their income is in a certain level. They get some help paying for it. But maybe you got a new job, and now you're not getting as much subsidy. It would be a time to take a kind of reevaluate what was important to you. Maybe during the year, someone in your family developed a condition, and now they need to see a specialist. It may be important to research which plans have that particular specialist. So it's always just a good idea to reassess what your needs are year to year.
Yeah, things change for sure.
Definitely.
Okay, let's get to our next question. Is there a reason I should choose a Fidelis plan over what I already have? So another good question. Why choose a Fidelis plan over something that you may already have?
Well, one of
Go
the
for it,
things
guys. That's why you're here.
If you already have insurance, good for you. But what I could tell you is that being the largest health plan in the state of New York, we pride ourselves being a statewide plan. We pride ourselves being a quality-focused plan. We have over 4,000 employees in the state of New York. Our network is over 80,000 providers. Just one of the things that highlights how great we are. But we have close to 1.7 million individuals enrolled into an individual plan in the state of New York. So I think that
That's a lot
itself,
of people.
that's a lot of
One of the
people.
largest, yeah.
And those people, we pride ourselves in making sure that those individuals are being taken care of. And that our providers who are rendering services to the consumers are also on good standings with us by making sure that they are providing quality insurance, quality assistance to the consumers, and then we make sure that we hold them accountable to that. So it's a partnership between the health plan, the provider, and the consumer.
Yeah, and one thing I just want to add is a lot of people say, you know what, I get coverage through my job, but it's expensive. Or my deductible is very high, because the trend right now is to go to high deductible health plans. These types of programs that are offered on New York State of Health are not a substitute for your company-sponsored insurance. That's called group insurance. If you have group insurance, you need to stay with your group insurance unless you can document, and there's a formula that's used, that it's unaffordable for you based on your salary. So this is for people really that don't have that option and need insurance and would otherwise not have anything.
Good clarification, Lori. We have another question in. If I already had Fidelis Care in 2017, will I still have it in 2018? So if you had it, yeah.
I think it's kind of
we
a similar
spoke to that.
process,
Similar
of,
process.
of the recertification process that we mentioned. I think all these questions are great, and it just reaffirms that we have to go out and seek assistance.
Yeah.
You have to go out to our fideliscare.org website. You should reach out to us. Our main number, 188-FIDELIS, or 188-343-3547, which are important numbers for you to go out there and seek assistance. We will have someone on our member service line to educate you as much as possible. If you need someone to go to you, remember those 225 individuals I mentioned in the New York City area? those individuals will go out to your home. They will meet you at the local Starbucks. They will invite you to come to one of our 20 facilities that we have listed as a community-based office throughout the state of New York. So there's always a way, and we are always willing to assist.
Wow. I also was reading online something called a session on your Twitter. On your Twitter, you were saying special information sessions. That's an opportunity, too, to get a bit more information?
We actually have informational sessions in our community offices and around New York State for people to come, answer their questions, get a presentation on Fidelis Care, and we'll actually sit down with that person. We have a tool on our website. It's called the Affordable Care Advisor, and not only is it a great source to see competitive information and what's out there, but based on your a few simple questions. It's 3 questions really. You can put in your income, your number of dependents. It'll tell you what plans you qualify for and how much the plans will cost. Wow. So instead of having to go through the whole process and then finding out at the end, it's a really nice way, and this is available on our website for anybody, by the way, so anybody can go to fideliscare.org and go to our Affordable Care Advisor. You can find out, hey, do I qualify for some assistance? What's the plan going to cost? What do the deductibles look like on this plan and co-payments? Because those factor into decisions.
That's so helpful. Like you said, you could just get it right there. You don't have to go deep, and then say, oh, this isn't going to work for me an hour later. Yeah, you just right there, you get some basic info.
And that tool it's great that Lori mentioned that tool. The Fidelis Care Advisor is a tool where you're just essentially shopping, and you put your personal information, your income, and your family size, and that will tell you what plans you're eligible for. And you'll be surprised that based on the family size and your income, you might fall into a very affordable plan. And if you are interested in finding out more information through the Fidelis Care Advisor, you could generate some sort of a referral that will directly come to us, and we'll reach out to you immediately.
Easy. Good. Okay, another question in. I recently lost my job, but don't want to lose my doctor of 20 years. Would I have to pay extra to keep him? I think everybody can kind of relate to this. Everybody has a personal connection. Yeah, I'm sure you get this question often.
One of the major reasons that people start looking at options under New York State of Health is job loss. And years ago, and now we're, I guess, 4 years into this program, if you lost your job, your only option was to continue on COBRA, which is continuum of coverage. You would have to work with your employer for them to send you the paperwork. Sometimes that can be a little uncomfortable depending on why you leave. And the plan, whatever the employer paid for and what the plan design was what you had to pay. And many people are shocked when they see how much was contributed towards their health plan, because people think that your contribution, maybe it's $300 a month, is what the plan costs, when in fact it may be $1,500 a month. So a lot of people would go without. With the onset of New York State of Health, people that are unemployed now can use that as a qualifying event that does enable you to come to New York State of Health and pick a health plan, and you will get, you may qualify for some assistance as far as in the premium. Now the person asks, can I keep my doctor? That's when you need to start checking with your physician what plans he takes. You can't work a deal through the plan to keep your doctor, but most doctors do participate in some form of a New York State of health plan, because this really is a popular program that's just taken off here. And that's where you would ask your doctor what plans he takes on the individual marketplace, and that's where you should start.
So this is important to key into the life-changing situations.
Yes.
Can you kind of go through that? Like, say you do apply by the 31st, or you don't apply by the 31st. Kind of what happens in the year for those people who are enrolled, and maybe they have a life-changing situation who aren't enrolled. Yeah, if you could kind of talk us through that.
Sure. Well, a life-changing event is something that happens, I like to think of it as something that affects your family size. So you get married, you have a baby, you get divorced, you lose your job. Maybe you adopt a child. Maybe you've moved into New York State from another state. These are all things that qualify you to come to the marketplace and choose a plan. Maybe you didn't choose a plan because you couldn't afford it now, or you're going to stay on on coverage, and now you're getting divorced and you lost your coverage because you lost your spouse. These are situations you can come to the marketplace and choose a plan now, mid-year. Open enrollment is going on now, and this is sort of that once a year window where people can choose a plan. So if you choose a plan now, by next, the 31st is what, Wednesday?
Yes.
The 31st, you will have coverage for March 1st. After that, sort of the window closes, and unless you have one of these life event situations, you'll have to wait till next year to enroll, and the open enrollment usually starts in November. Okay, so we try and emphasize this because very often people say, I'm going to take my chances now, but now in July something happens and, you go to the doctor, he says maybe you're diabetic, you're going to need, you realize you're in for a lot of health care. That's not the time that you can select a plan because the window of opportunity is closed. So it's important to really take a look at all possible situations before you decide not to have anything.
And in your example, July till you can enroll is a long time. Right. Okay.
And I think Lori emphasized the example of, don't wait until you have diabetes. We are focusing on preventive care, and I mentioned that partnership between the provider, the consumer, and Fidelis as a health plan. We really emphasize to make sure that people stay healthy. We're, in the middle of flu season. There's a lot of things that you could do by working with your provider to make sure we prevent from individuals from, getting anything worse and avoid as much as possible. So, that's like, I put an example to individuals. You won't be driving without car insurance. We shouldn't be walking down the street without health insurance. That's more important. So I think that's why we're here, and that's why we're focusing on that deadline of the 31st of this month. Wednesday is the day. So.
Yeah, and Lori said, I think that was the first time we mentioned it. We mentioned before that January 31st is the deadline, but March 1st is when
the coverage becomes
begins.
effective.
Okay, good. All right, let's see what else we've got. Can I enroll everyone in my house, grandparents too? Great question.
Good question.
Yeah.
So I think Lori emphasizes at the beginning in her intro is that we have a product for individuals at any phase of age or within their life. So we have a product such as Child Health Plus for children under the age of 19. And we have products that are from 19 all the way through 65. And those are Medicaid, the Essential Plan, and all the qualified health plans that we mentioned here, such as the catastrophic, the bronze, the gold, the silver, and the
Platinum.
So those are for individuals up to the age of 65. And then we have a very good product, which is our Medicare lines of business, and we have products for individuals over the age of 65 and disabled as well. In addition to that, we also have products such as managed long-term care for individuals who are frail and elderly and are in need of a lot of assistance, and they don't want to be in a nursing home.
Yeah.
They want to stay home. And so we have a lot of products in a very specific situation. That's why it's extremely important that you reach out to Fidelis. You call us at our 188 number, Fidelis. In addition, you can find more information at fideliscare.org and making sure that we have someone to go out there. And our individuals who are in the community are able to assist you for all these lines of business, educate you as much as possible. If they're not an expert in it, they will refer you immediately to someone who is.
Yeah, we have our reps specialized in certain lines of business. So we have people that focus on the senior population. So we have experts in Medicare and experts on MLTC, which is really one of the newest and most talked about products right now because it addresses a need that people have of a parent or grandparent that may be frail, maybe in need of a nursing home level of care, but what do you do? How do you care for them? You keep putting them into a nursing home may not be possible. Managed long-term care plans actually bring the care to that person in their home. So that's a very big issue right now as we're part of the sandwich generation, and we have our grandparents, our parents, and our kids that we're caring for, and our reps specialize in all these lines of business.
Well, I hope that my mother is listening. My grandma is 95, and that sounds amazing. So everyone can appreciate multi-generations, a lot of different.
That's very common, especially in the state of New York.
Yes, that's awesome. Let's go back a minute and just talk about, you mentioned the many different lines of business. So which needs to be enrolled by January 31st?
So the deadline applies specifically for our qualified health plans, which is the catastrophic, the bronze, the silver, the gold, and the platinum. Those individuals who are shopping for those type of plans, and make sure that you don't assume that you qualify for that, because you might qualify for other plans that you could enroll during the whole year. So we
Okay.
could specifically speak about those later on. But
Yeah.
for the qualified health plans, that's where the deadline applies for the 31st. That's why it's extremely important, again, the focus of reaching out to a Fidelis Care representative by calling us or going into our website. You could get someone to reach out to you, meet with you, to educate you what you're eligible for.
Good. Okay, let's see what else we've got. Does this cover same-sex partners?
Good question.
Well, we enroll everybody as an individual. So unlike group plans, like you may get through work where you have to have that domestic relationship and be able to prove it, everybody that comes onto Fidelis is just enrolled as a single, as an individual. So we may have, and we do have many same-sex partnerships, but to us, it's a single application for each person that enrolled.
And in certain cases, you could apply as a family.
Yeah.
And if it applies to the situation, as long as you use that individual as a family size and you include their income, if there's any, that's not something we focus on. We focus on healthcare, not in regards to anything else.
Got it. Okay, a lot of great questions coming in. So I just want to remind everyone, abc7ny.com is the website. We'd love for you to go submit your questions. You guys are very informative and I'm sure giving a lot of great information. Again, just want to share, if you would, or I can, the website and the phone number for Fidelis, a good kind of regroup time.
So our Fidelis Care website is fideliscare.org and our number is 188-FIDELIS or 188-343-3547.
Okay, let's see what we've got next. What would my co-payment be?
Okay.
Lori.
Okay. Co-payment is the payment that you make when you go for services. Many people think of co-payments as like, what do I pay per month? We call that the premium. The co-payments vary, as does the premium, depending on the program that you take. So just as a general rule, since we're talking about products on New York State of Health, products are named, we call them the metal plans, right? And the better the metal, or the higher the metal, the richer the plan. So on a platinum plan, for example, which is the richest and obviously the most costly plan, you're talking about a program with very low deductibles, very low co-payments. So you can use that, get started and start using your benefits very early into the plan. Plans, some people feel more comfortable in, I'm just going to pay less because I don't get sick a lot. So I'm going to take a plan with a high deductible, may have higher co-payments, but the premium's lower. And these are things that you need to evaluate. So if you're a person that you use a lot of medical services or you have a condition that January 3rd, you're going to start going and getting your prescriptions and going to the doctor, even though a plan, like a bronze plan, for example, which is sort of a lower premium, more expense for you as you use the plan, you really need to evaluate, is this the best plan for me? If it has a high deductible, I have to pay that before I get the benefit of my getting into my co-payments and my co-insurance. So these are the things that we really try and help people in evaluating, just really having a serious talk about, hey, how do you use your plan? How do the different members of your family use your plan? And, that's where a representative can really help.
And I think another thing is just don't assume that you will fall into a plan that has a co-payment or that has a premium or that has a deductible. That's what's extremely important, that you reach out to us. You might be eligible for an essential plan or one of our Medicaid plans. And with that said, you might not have a premium or you might not have a copay. So it's very informative. Our website is very informative, so feel free to reach out or go on our website and get additional information.
Yeah, and I want to just touch a little bit on the Essential Plan because George mentioned the Essential Plan, and this is a program that came out, I guess, about 2 years ago. It came out after the metal plans, really our most popular product. This was a program designed for people that a lot of them fall into that minimum wage situation. Maybe they're making like less than $24,000 a year as a single. A younger person getting started in their career, okay? If you qualify for the Essential Plan, we have 2 levels based on income. One plan has 0 premium, meaning you pay nothing to have the plan if you fall on that income level. The other one is just $20 a month with low or no deductibles, low or 0 co-payments, depending on where you fall. So this was a program that was really designed for a lot of the young people, the invincible people who thought nothing was going to happen. It's a really affordable, great benefit. So many people do fall into that essential plan income category, and all these programs really are income based. So I think you'd be surprised if you go to the website and see exactly what's available.
When you started, you said all ages, yes, and we've tapped on all ages so far. It's amazing how there's something for everyone.
And I think, and you'll continue hearing the media, so we pride ourselves in our staff. So you have 4,000 individuals that work for this organization who pride themselves in making sure that all individuals of all ages seek insurance, seek assistance, or get educated in regards to the healthcare options.
That's great. Let's see what else we have. Is there a tool online to figure out how much coverage would cost?
Sure. We have the Affordable Care Advisor, and if you go to www.fideliscare.org, it's right up on the website, right on the front page. You can say find a plan and how much, can I afford this? And you just put in those 3 bits of information George referred to, your family income, your number of dependents, and I think that's really, it's just two or 3 questions.
Yes.
And it'll tell you what you would qualify for as far as the plan, and also give you an idea if you qualify for a subsidy to help you pay for it. And for 2018, for the rest of this year, there still are subsidies in place for people. A lot of people think that, legislation just passed and now I don't have to have insurance, or I'm not going to get any more subsidies. That's for 2019.
That's a good point, Lori. So 2018, you still, besides the reasons we already talked about, the benefits of having health insurance, that you just never know what's going to happen. 2018, you still need health insurance.
Correct.
Yeah. Okay. Let's see what else we have. Will my Fidelis plan cover hospice care? These are great questions coming in.
That's a great question,
Yeah.
and unfortunately, it's an unfortunate question.
I know.
Or a benefit that it's not a good one. But
Yeah.
with that said, I think for an individual that has Fidelis and is in need of that benefit, yes, it's covered. But for an individual that doesn't have any insurance, it falls into that we won't be the best plan for that need. Or and that say you're already in a hospice care situation. So there's other ways for you to seek assistance through there. But for individuals, out of the 1.7 million that we almost have in the state of New York, if they will ever need that service, is covered.
Yeah, that's a tough situation too.
Yeah.
Yeah, our heart goes out to that person. If my job already provides insurance, can I still sign up for this? I'm not crazy about my current insurance.
Number one question we get, our representatives get this question probably about 10, 15 times a day. And I think I mentioned before, the trend right now in group insurance, employer-sponsored insurance, is high deductible health plans. But you cannot waive off your insurance and just take this. You have to stay with your company-sponsored plan unless it's financially unaffordable for you, and there is a calculation that's done in order to determine that. So it's not just on your personal preference. It's not to replace the employer plan. It's to help the people that don't have the privilege of getting benefits through their employer.
Mm-hmm. I think it's important to take a moment, if you could, for people who aren't as familiar with the New York State of Health. How does that work? So can we just talk a bit about that, the logistics of how you're kind of enrolling through New York State of Health?
It's interesting how Lori mentioned that going into Amazon or shopping. That's what the New York State of Health is. You go there, you create an account, and you just go out there and provide your basic demographic information, and you'll get all the listings of all the plans in the state of New York, what are the benefits, and what are the costs, if there is a cost associated to the plans that you're eligible for. So it's shopping for insurance
Shopping on
the same way that you're shopping for
and
anything you're shopping online.
Perfect.
It's a user-friendly process in regards to enrolling, and that's why I refer that you go back to a specialized individual, a Fidelis Care representative, to go through that process with you.
Can I enroll in dental insurance only? So this person wants only dental and no medical.
Okay. Well, Fidelis Care currently doesn't have we call that a freestanding dental plan, meaning I want just dental, I don't need the medical. We don't offer that on the marketplace, but New York State of Health Marketplace does have dental insurance that folks can choose from most of the major carriers. So you can go into New York State of Health, select dental, find me a dental plan, and it'll bring out the plans in your area along with the coverage and the cost. So that is an option.
And that's for the qualified health plans, but for plans such as a Child Health Plus plan or a Medicaid plan, which are for the lower income individuals in certain cases, that's already included and you don't have to pay for it. So it's a rich benefit with no cost associated to it. So again, go out there, seek assistance, and a Fidelis Care representative will educate you about those options.
Thank you. Next question, will I be covered for a pre-existing condition? This person has lupus and they're wondering if they're going to be covered with their pre-existing condition.
That is a great question. And one of the benefits of the marketplace coming to be 4 years ago is that it eliminated pre-existing condition disqualification. So in years past, if you needed to find coverage because you had a condition like lupus, it would be very hard for you. First, many carriers didn't offer individual plans. Second, they could cover you but not the condition that you needed it for, or make you wait out a certain period of time before they'd start covering you for the condition. A condition like lupus is very chronic, it flares, you need care right away. So we don't ask any health questions, no plans do, on the marketplace. So that's not even a question that's asked. The thing that I like to emphasize with people is, yes, we will cover you for your condition. Yes, we have rheumatologists and doctors on Fidelis. Is it the doctor that you're currently using? Because if you're using a doctor and you're going to him a couple times a month for care, you need to factor that in and see if your doctor is on the plan. Now, for some people, they say, you know what, the benefit of having this program outweighs me having to change my doctor. And that's great, but for some people, they really feel very, very strong that they want to keep the doctor that they have, and that's where you need to have those conversations with your doctor. So yes, you'll be covered, but you have to make sure that it's going to be covered the way that you want it to be covered with the doctor that you're seeing. And the lupus medications and care for that, that's covered as part of the program.
That's so smart. You really have to make some important decisions. You can't assume. You really need to look into these things. Yeah. Okay, let's see what else we have. Another question, do you provide incentives for healthy people, for example, low BMI?
Wow, good question. For some of our lines of businesses, we have what we call a member incentive, where we work with the providers to make sure that the consumer or the member goes out and seeks services, in certain cases of his children, to make sure that the children go out there and get their immunization. So remember I mentioned the partnership. So we will work with the provider to make sure that the member is healthy. In certain cases, and a lot of that information is in our website, or you can also work with your provider in regards to this. All that information is available for the provider, for the member. If individuals are eligible for an incentive, we will notify the consumer, we will notify the member, and in certain cases we will incentivize the provider and the consumer to making sure that people can preventive care to make sure that they maintain themselves healthy.
Neat. Yeah.
And that's a big trend right now in healthcare. That's something that plans like Fidelis are really taking a strong look at. Programs that you don't have to be sick to take advantage of, programs to help keep you healthy.
So all those New Year's resolutions get to
Gym membership is covered as well.
That's right.
Some of our plans. So.
Really?
Yes.
Oh.
Very good New Year resolution. So.
That's great. Yeah. What kind of confirmation of benefits will I get?
Well, again, all that information, all that confirmation is always available in our website and also in the New York State of Health. But when you meet with a Fidelis Care representative, that's part of that one-on-one session, even prior to the enrollment process. We're not going to start data entering or typing information to the website without the benefits being explained to you, making sure that you understand everything from soup to nuts in regards to your healthcare needs and your options and so on and so forth. The key to our success and our reputation has been quality, and that leads to customer service. So our representatives, our staff members in the organization will make sure that we focus on every person one at a time and make sure that we explain everything in detail. And in certain cases, as Lori mentioned, we might have a situation where we might say, unfortunately, I cannot enroll you because we don't have your provider on our network. We will try to work with your provider, but I cannot promise you that. But, we don't want to disrupt your healthcare needs right now, and these are your options. And as individuals working for this organization, very limited because we have a diverse network, but we have had to refer out to other carriers because of that. But we're not just going to enroll you without explaining that. So I guess there's many options. There's a lot of literature that we provide and give out to the consumers that explains the benefits, and that information is always available in our website as well for
Good to know, yeah.
And we want to make sure that our representatives aren't rushing through the appointment, that they're really taking the time to cover all the specifics of the plan. So all of our representatives give our clients a receipt, and on the receipt we'll write the plan that you've selected, the premium, go over a checklist with them, making sure that we've covered all the key components of the plan. If you choose a plan with a premium, it's important to note that when you walk out of the office, you're not done, because you need to pay your first month's premium in order to generate your ID card. So we get a lot of calls, gee, I didn't get my card yet. And the first question we ask is, well, did you pay in insurance? Obviously, you don't get your car insurance unless you start that too. You need to pay your first month's premium in order to generate your card. So that's important just to note also.
Yeah, that's a good note. So, and you can, I'm sure, do auto pay. I'm sure there's a million ways to make this easy for you.
And our representatives will work with you in setting that up, the auto pay if that's the case. And if that's not an option, we will list all the different options to make sure that payment is there on time.
So everyone who's watching, who's saying, all right, this is on my to-do list, I really got to get this done by January 31st. Yes. How much time should you, I guess it's different for each person, but how much time are you talking to enroll? I'm sure it's different based on the amount of questions you have and how much time you want to put into it.
But, even if we say it takes an hour and a half, what does that mean relative to what we are actually, the assistance and the support and what you're going to get in return to it? So I think time is not of essence right now. I think the importance is health. And the 31st is the deadline. Let's not wait until the 31st.
I agreed. I'm the type of person I
want
the answers.
It's always very crazy on the 31st.
I'm sure it is. I can only imagine. Okay, can I change my benefits after open enrollment is over?
Great question. So open enrollment, we talked about that window closes, and you can't select a health plan unless you have a special situation or a special election period. And we talked about some of those things, a birth, a death, a marriage. Those are situations where you can choose a plan. You can't, as part of open enrollment, you can't change your benefit mid-year to, now I'm going to take this plan. I want to take a plan that's going to cost a little bit more, so I hit my deductible. You can't do that after an open enrollment. So after you've made your selection and open enrollment closes, you're going through the rest of the year with the plan that you have.
Choose wisely.
Choose wisely.
Mm-hmm. Okay, let's see what else we have. I had a child recently and have Fidelis. Can I add her? What documentation do I need?
Good question. So if you already have Fidelis, most likely you already have someone that you could trust, that you could reach out to and kind of ask that question. It's very simple. It's just adding someone to your case. And with that said, we facilitate that process. In certain cases, the marketplace, which is our hub, and that's where we utilize the data, enter every information, might ask for additional information, such as the birth certificate as an example. And we will facilitate that process. We'll scan that document if it's requested, and we'll upload it into the marketplace so they can review it and effectuate the consumer, in this case, a new child. And if it's enrolled prior to the 15th of the month, they will be effective the first of the following month.
So if you had that baby and forgot to do it, open it now. Do it now.
And congratulations to you. All right, what are my out-of-pocket expenses? Is daycare covered?
Ooh, daycare.
Okay.
Unfortunately, daycare is not covered. I think that's a benefit a lot of people would like.
Would love, yeah.
We're focusing on healthcare, but with that said, out of pocket, it's different. It's different by line of business. It's different by plan. So it's very important that we sit with a professional that works for Fidelis Care who will educate you in all your options and will, work through that process. But, so many different plans, so many different options that it'll be kind of redundant to explain. But our website has it, the Fidelis Care Advisor, which is that tool that you can kind of shop on our website for. We'll give you all that information as well.
And I want to, they asked about children, so I like to talk about Child Health Plus. We call it CHIP because it's such a great benefit. And what we find is a lot of people, maybe you're going to go without for yourself, but most people really want to make sure their children are covered. And kids need immunizations, they need exams for school, they need glasses, they need dental care, and Child Health Plus covers that. The beauty of a program like that, if you were to put your child on Child Health Plus, is that the premium is based, or how much you pay to have the coverage, on your income. Okay, so anybody can choose Child Health Plus, even if you're a working person with a good salary, but you're just covered for yourself. You can put your children on Child Health Plus, and you pay the full premium, which is less than $200 a month. So that's a great value. Down as low as $8 a month. But once your child has Child Health Plus, there's no co-payments for getting services. So if you need to take your child to the pediatrician, they need to get their tonsils taken out, they need prescriptions, they need glasses or dental care, that's all covered as part of Child Health Plus. So we don't cover daycare, but we have really good child care under programs like this.
Sounds so good, like a no-brainer, just it's out there, it's available.
Mm-hmm.
Wow. And I did see you guys here, right here, abc7ny.com over the summer talking about this.
And I think that
Every
our
child
focus,
should have
our focus then a few
child.
months ago when we were here, it was around Child Health Plus and focusing that we have over 100,000 children enrolled into Fidelis Care Child Health Plus, and our focus is to make sure all children are enrolled into Child Health Plus. There's not a reason why there should be a child without health coverage today in the New York State of Health.
It makes you feel like, what a relief.
Including
all those kids get covered.
undocumented children. So, unfortunately, there might be a lot of undocumented children. If the parents are undocumented, the children should not be without health care. It doesn't, and we don't ask any of those kind of questions. And so, again, there shouldn't be any child out walking in the streets or in the school system without health insurance right now.
Child Health Plus, that's the name. Just get your child covered.
That's right.
Great. Good. Anything to add to that? I know that's a really, really important topic there. Child Health Plus, and that's you can do anytime. Is that right?
Yes, that is all year long. The renewal or the recertification process is based on your start date. So if you enrolled into a Child Health Plus program, or your child did in March, you'll have to recertify or renew your coverage for your child the following year. March the following year. So it's different from the open enrollment process that we're just discussing now.
Yeah. Okay. And you can keep your kids in Child Health Plus through age 19. So.
Wow. From what? From birth?
From birth.
Wow.
So the individual that asked that question, get them enrolled for the effective date of March 1st, and we'll have that child, God willing, with Fidelis all the way through the age of 19.
She's probably very
Get 'em
glad
off the
she asked
college
that
health
question. Yeah.
It's a great plan.
It's a great plan. All right, let's see what else we have. Do you have people that speak different languages? My father is interested in enrolling but does not speak English. Yes.
Yes. And Lori mentioned that earlier.
Said yes.
Having
a lot of languages.
we have staff on the marketing side or individuals who are out there in the community that speak over 30 different languages. We specialize in making sure, as I mentioned, having people from the community. So if we are in an area such as the Arabic community in Bay Ridge, Brooklyn, we have individuals from the community that live the community, that speak the language, that know the culture. So we have to be sensitive for many things, and we pride ourselves on that, utilizing the Arabic community as an example. If we look at the Hispanic community, which is probably the largest in the state of New York, who are non-English speaking, we have hundreds of Hispanics working for this organization. One of is myself, and making sure that we educate and assist as much as possible.
Even our website and our information, you can request our information in English, in Spanish, in Chinese, in Russian. We have that all readily available. A lot of our information is now getting translated into Arabic, Urdu, and some of Bengali, those languages. So if we have the materials, but most importantly, we have the representatives out of those communities that know the doctors in the community that people go to and work in those areas. So we really try and take a real multicultural approach to our community, because New York is very diverse.
Yes, and I'm sure like 400.
Excuse me.
No, go ahead. you know, for her father, he can speak directly and get the questions answered, not have to go through her, and you know, it just makes it a little more seamless, a little more efficient,
and the
comfort
trust,
level.
and the comfort level,
Yeah.
and trust. I think that's also helpful. And how do we know that there's a need, and why do we go out and develop certain communities and hire from the community, hire individuals who really want to give back to the community? Because we've been involved. We go in there and run into a situation that we're like, oh my God, we have a specific community that's in need. So we do that legwork. We make sure that we have the right providers before we even go out there and start enrolling people, because that's not the whole purpose. Is making sure that we provide quality health coverage, and it starts at a very down into the roots of the community to understand what the needs are first.
Yeah, so you're doing the work on the back end.
Exactly.
Yeah.
And even in the community, you know, people say, how do I find a Fidelis representative? Yeah, we have 20 offices just in our region that service people, but you know, you may find a Fidelis representative in a church, in a library, in a community-based organization, in a program like a Head Start, a Catholic Charities. Social service agencies that help the community are tied to Fidelis Care. So we have obviously walk-in offices, but you'll see us in even supermarkets, pharmacies, places where people go in the community to get information.
That's interesting. Let's talk a bit about the history of Fidelis Care, kind of the founding and how it's grown, and just those principles that it's based on. That have what it is, the setup that it is today.
Yeah, I think it's interesting, and it's very important to mention something that we pride ourselves. Fidelis Care started back in 1993, and we were funded by the 8 bishops of the state of New York. So we were funded by the Catholic Church, with the vision to making sure that plan, Child Health Plus, the focus was specializing in Child Health Plus, because that was a program which was kind of very fresh, and you know, people were trying to assist and making sure that as many kids are enrolled in it. That was the goal. It was a goal of enrolling as many children in Brooklyn and Queens as possible. And it has extended to be what we are today, the largest managed care organization in the state of New York, by having close to 1.7 million members, by having a network of close to 80,000 providers, 4,000 employees, and so on and so forth. Having all these community offices that Lori mentioned, partnering up with a lot of organizations throughout the state to make sure that we work together. Let it be in the supermarket. We don't just set up shop in the supermarket. We work with the supermarket owners, understand what are the needs of that community, and partner up in doing these health fairs or seminars to educate their population around healthy eating and so on and so forth. We have a program which is our Lunchology initiative, which is a homegrown product where we work with a lifestyle expert who goes out into the community with our staff to educate individuals around how to prepare healthy meals, as an example. All that information is on our website, fideliscare.org. But those are ways that we just kind of engage into the community, and that has been the key to our success, really locally driven and working with one individual at a time.
Investing in the community, the people.
Yes.
Yeah, great reward. Okay, we have time for a few more questions, so if you have anything that you haven't submitted so far, go to abc7ny.com. Got about 10 more minutes, so we'd love to answer those questions for you. Here we go. You mentioned earlier the 20 community offices. What can I expect when I go into an office? I'm sure a lot of people have that question. What is that like when you go into one of the offices?
You know, you'll be greeted by one of our customer service representatives that will ask you just a couple questions as far as what what you're there for. Are you there for new information? Are you there to, George mentioned, recertify and continue your plan? And what products. So we have product specialists that work in every community office. So we have folks that specialize in Medicare. So they're well versed in our Medicare program. So if a senior comes in over the age of 65 wanting information on that, we'll send them to our Medicare representative. Our other representatives will sit down with you, ask you the questions, go through a little bit on the wealthy, we call that the Affordable Care Advisor, and take down your information and kind of walk you through the process of what you need. Before you come, you can make it a little bit easier by just knowing who your doctors are, your prescriptions, your income, your family size, some basic questions that will be asked in order to facilitate an application if you want to do an application. It's really it's not a pressure kind of situation. It's more consultative.
And I bet the more you bring to it, the more you get out of it. It sounds
Exactly.
like.
I see our community offices as a community center. So if individuals have any questions around anything in that community, walk into a Fidelis community office. We have individuals that speak your language and read your language. There's certain offices here in Manhattan, as an example, in the upper Manhattan area, where we have individuals walking into one of our community offices just to read or translate a letter that has nothing to do with healthcare. But we have developed that trust with the community. So there are endless opportunities and there are endless reasons why you will walk into that community office, but go in there and understand and know that it's someone you could trust and is going to educate you around all your healthcare options.
Yeah, that example speaks volumes to
It
what
does.
you're doing.
And the one thing that I really emphasize and I really feel is that the people that work for Fidelis are a little bit different because they really have that charitable, community-based spirit. I know people are probably rolling their eyes when I say that, but they almost have, a service mentality in helping people. They feel so strongly. They love what they do. They love helping people, and I think that really shows. The employees are really happy and feel very gratified for helping families that, maybe came in, were really worried about how they were going to get their kids covered or have a situation, just allaying their fears and getting them into the plan that's right for them. So I would think that most people say it's probably a very positive experience.
Yeah, I mean, you only get one life. Your health is your health. Like,
Right.
to have that relationship and have that service-driven to help you reach your health goals. That's great.
I think I just want to reinforce our community office for the senior population. Medicare is extremely complicated. It's complicated for me, and I'm in the industry. So if they have any questions or concerns, walk into our community offices and speak to one of our sales individuals to educate you about your options. And even if you're already enrolled into Medicare, if you have any questions around your benefits, if you have to make a payment, how to make it, we will assist you in all of those situations.
Yes, it can be confusing even
Yes.
after.
Oh, yeah.
That's what I hear. Okay, let's see. We got a few more. Does Fidelis offer plans for someone with green card or alien status?
Yes. Yes, and that, again, from every status is different. Each individual case is different. So, again, never think that you're walking into a situation or to a community office or when you're meeting with a Fidelis representative that we're going to be asking questions around your immigration status. We'll go through the checklist and ask you key questions. And if you qualify based on all the guidelines that have been provided to us and that we drive and are mandated to enroll individuals on, you will qualify for these coverages. And being a legal alien or a green card holder in the state of New York, yes, you're eligible for health coverage. Obviously, that's one of the categories that you have to meet or requirements. Income levels and family size have a lot to do with it as well.
Right.
But we talked about bringing the information to the appointment. If you fall into that situation, you need to bring your active green card with you to your appointment, because what will happen is that information is input into the New York State of Health website for eligibility. So.
Thanks for sharing, so you don't need to make a duplicate trip.
Right.
Yes.
Right. Okay, we've got how many doctor visits are covered per year? Is there a max? I guess it depends, doesn't it?
Well, there's not a max as far as the number of visits per year. And one of the things we talked about when the Affordable Care Act was passed and they created these marketplaces, they did away with pre-existing conditions. They also did away with day and dollar limitations. So if you were sick, you don't have to worry that the plan is going to run out if you're in the hospital for 80 days. The program is continuous coverage as long as you're on the plan. So a lot of the concerns and issues that people faced in the past, if they were sick or they were worried about being in the hospital in the old world before the marketplace came, have been alleviated with the New York State of Health.
Wow. Yeah, things are different and change, so that's great, Lori. Maybe some people didn't realize that. Will Fidelis change coverage during the year? For example, if a policy change is made?
I don't foresee that happening. I've been in Fidelis for 13 years, never had that happen.
Okay.
Obviously, at the beginning of the year, when we're talking about the qualified health plans, they're always, and that's why we're asking people to come, even our current members who are part of one of our qualified health plans, to go out there and seek assistance from a Fidelis care professional to make sure that you re-enroll for 2018. Because there could be change. let it be a premium change, let it be a networking change. There might be a lot of changes, but a lot of the times the change is more beneficial for the consumer than anything else. So change is good, and again, come and seek assistance, and we'll educate you in regards to those processes.
The plans that we file for New York State of Health and Medicare, we file annually. So those programs and that plan design and the co-payments is locked in for the year. So if you enroll in a plan for 2018 now, that is the benefits that will be continuing through the year. If a provider is added to the network or leaves, or we add drugs to the drug list or make changes, that could be a change. But as far as the plans and the premiums, those are locked in for the time period for the upcoming year. So it's current, what's on our website.
Got it. What categories fall under the, quote, life status change? Yes, okay. Yeah. That would be good to know.
Lori's good at this.
She's got this.
I like to think of it as anything that changes the number in your family, if there were, changes your financial situation dramatically. So you lose your job, you get married, you adopt a child, you have a baby, you get divorced. You move into New York State because, New York State, everyone talks about Obamacare, but New York State actually we have our own plan here through New York State of Health. We're not part of that national exchange, so we're not experiencing a lot of the same issues that people outside New York, even in places like Connecticut or New Jersey that don't have their own exchange, do. So those are some of the things that you can, that are qualifying events that would enable you to change your health plan.
Mm-hmm. Start winding down. Okay, guys, it's almost time. So I would like to just, with the time that we have left, talk about, again, the deadline, the enrollment deadline, and then when your insurance becomes active, and just, again, categorize what the deadline is for and what you can enroll for throughout the year, and anything that you would want to add before we sign off for the day.
I think I just want to reemphasize the importance of health care, the importance of preventive care. Letting the community that's listening right now and seeing us that we have a great reputation. We've been in the business since 1993. We are the biggest and the best. But most importantly, January 31st. And the importance of January 31st being the deadline for enrollment for the qualified health plans. Never lose focus on Child Health Plus. It's a year-long program. But January 31st is the deadline for open enrollment for all of our qualified health plans. Please feel free to reach out to us. Call us our 188-FIDELIS number. Go to our website, fideliscare.org. Utilize our Fidelis Care affordable tool to make sure that you self-educate yourself through there. You could generate a lead. We'll contact you back. Walk into our community offices. But, again, we're visible. Find us.
Lori, anything you want to add?
I would just add that, don't assume. People, this is going to be too much, or I can't afford this, or my doctor's not going to be on the plan, or, we're not going to be covered for this condition. Be a good healthcare consumer for yourself and your family. And, as we mentioned, there's plans for babies starting out all the way to seniors that need a very extensive level of care. Take a look at what options are out there. There are options out there. I'm not saying that Fidelis Care is necessarily going to be the perfect plan for you. Everybody has specific doctors and considerations when they make their plan, but be an educated consumer, because it's so important. And the time to do the research is not when you're in that crisis situation where something very critical has happened and now you have to start making decisions quickly.
Well, you guys have been so informative. Every open enrollment, I'm calling you guys. Thank you so much.
Thank you, Danielle.
And thank you to everyone who's been watching for your great questions. We hope that you got your answers, and we hope that you get covered. So that's all for today. We'll see you on our next live web chat here on abc7ny.com. Good night, everyone.